In a world where health challenges continue to shape our daily lives, understanding chronic conditions becomes essential. Today, I present a narrative exploring type 2 diabetes, a condition that impacts millions and shapes lives through its subtle onset and long-term effects. I embark on this journey with a commitment to clarity and precision, intending to illuminate the complex nature of this metabolic disorder. In this setting, I paint a picture of a typical day in the life of many individuals who navigate uncertainty, drawing parallels between the initial apprehension of a diagnosis and the courage required to face the future. With deliberate care, the narrative unfolds in a logical progression, addressing key points such as causes, symptoms, risk factors, and the transformative power of early diagnosis and intervention. The stage is now set for an exploration that bridges scientific insight with the nuances of everyday experience, ensuring that the audience gains both understanding and reassurance. By the conclusion of this narrative, the hope is that every viewer will be equipped with clear, actionable knowledge, empowering them to make informed decisions about their well-being while confronting type 2 diabetes with confidence and calm determination. The journey continues by defining type 2 diabetes in precise yet accessible terms. Type 2 diabetes is a chronic metabolic disorder characterized primarily by elevated blood sugar levels due to the body's reduced ability to use insulin effectively, a condition known as insulin resistance. In this narrative, the importance of understanding the fundamental nature of the disorder is paramount, as it lays the groundwork for subsequent sections. The body, when confronted with excess glucose circulating in the bloodstream, struggles to convert this vital energy source into usable forms, thereby compromising various bodily functions. This condition emerges gradually, often unnoticed until subtle symptoms become apparent, making early comprehension all the more essential. By delineating how this form of diabetes differs from other types, especially insulin-dependent conditions, the narrative ensures that the audience is not left with ambiguity. Through a careful description of the underlying biological processes and an emphasis on the broader implications for overall health and daily functioning, the aim is to render the subject matter clear, approachable, and actionable. The narrative reinforces that while the disorder is complex, understanding its basic mechanics is the first step toward effective management and improved quality of life. The narrative deepens as the focus shifts to comprehensively exploring the causes and common symptoms of type 2 diabetes. A multifaceted condition, type 2 diabetes arises from an interplay of genetic predispositions, lifestyle habits, and environmental influences. In this detailed exploration, it becomes evident that hereditary factors may set the stage for the disorder, while lifestyle choices such as poor diet and physical inactivity can accelerate its onset. As I describe these correlations, the narrative emphasizes that modern living, with easy access to processed foods and sedentary routines, often contributes significantly to the development of insulin resistance. Alongside the causative factors, the narrative carefully outlines common symptoms that serve as important warning signs. These symptoms include an increased sense of thirst, frequent urination, unexplained fatigue, blurred vision, and slow healing wounds. By framing these indicators within everyday experiences, a routine morning where mild fatigue is overlooked, or an inexplicable thirst that hinders daily comfort, the narrative renders them both relatable and alarming. The audience is encouraged to view these symptoms not as isolated inconveniences but as interconnected signals of the body's gradual departure from its optimal state. Through an analogy to a well-tuned machine beginning to falter, the importance of early self-awareness and medical consultation becomes unmistakably clear, underlining the necessity of recognizing the subtle signs that often herald the onset of type 2 diabetes. As the narrative unfolds, attention is directed toward identifying risk factors and elucidating the pivotal role of early diagnosis in the management of type 2 diabetes. The story delves into familiar factors that predispose individuals to the disorder, including advancing age, genetic history, obesity, and an inactive lifestyle. Each risk factor is portrayed with clarity, ensuring that the audience recognizes that these elements often coexist and compound the likelihood of developing the disease. In addition, the narrative highlights the transformative power of early diagnosis. By detailing a scenario in which a proactive individual notices minor symptoms and promptly consults a medical professional, the narrative illustrates how timely intervention can alter the progression of the condition. This early action not only paves the way for efficient treatment but also instills a sense of control over one's health. The narrative positions early diagnosis as a vital tool, one that bridges the gap between the initial emergence of warning signs and a full-scale health crisis. With precision and empathy, the audience is encouraged to regard routine medical checkups not as burdensome obligations but as indispensable opportunities for preserving one's health, thereby anchoring the potential for improved outcomes and a healthier future. Continuing the narrative, a moment of reflection is devoted to the critical importance of diagnosis and intervention in mitigating the effects of type 2 diabetes. The text carefully outlines the pivotal medical procedures involved, such as blood tests and A1C level monitoring, highlighting them as essential diagnostic tools. This section presents a clear, methodical description of how these tests function as early indicators of the body's struggle to manage blood sugar levels, thus offering a window into potential future complications. By drawing on a relatable account of a typical individual experiencing persistent discomfort and subtle physical changes, the narrative demonstrates how a timely visit to a healthcare specialist can initiate a chain of valuable interventions. The emphasis here is on the empowerment that comes from understanding one's health status. Early diagnosis is presented not merely as a clinical imperative but as an opportunity to seize control, adjust lifestyle choices, and embark on a journey toward improved well-being. The narrative carefully conveys that while the technical aspects of diagnosis may appear daunting, the underlying message is one of hope and resilience. The promise that with proper and swift intervention, the progression of the disease can be significantly slowed, thereby preventing the onset of severe complications and ensuring a more balanced and fulfilling life. In this extensive and detailed segment, the narrative shifts focus to the comprehensive management strategies that underpin effective control of type 2 diabetes. Here, practical and sustainable lifestyle changes are explored with depth and clarity. The story begins by illustrating how modifying dietary habits can lead to marked improvements in blood sugar management. Emphasis is placed on embracing a balanced diet rich in whole grains, lean proteins, and fresh produce, while minimizing the intake of processed sugars and unhealthy fats. The narrative underscores the need for a thoughtful approach to meal planning, akin to orchestrating a balanced routine that nurtures both body and mind. Concurrently, the narrative pays particular attention to the role of physical activity. A vivid portrayal is constructed of an individual incorporating regular exercise, such as brisk walking, moderate strength training, and flexibility routines, into their daily schedule. Through this detailed account, the audience understands how physical movement enhances insulin sensitivity and contributes to overall health. Moreover, the narrative carefully addresses the use of medication as a supportive measure when lifestyle changes alone are insufficient. It describes, with precision, the circumstances under which medical intervention becomes necessary, and demystifies commonly prescribed medications by explaining their mechanisms in a clear and formal manner. The narrative is meticulous in portraying the interplay between these strategies, stressing that an integrated approach, combining diet, exercise, and, if required, pharmacological support, can effectively stabilize blood sugar levels over time. Analogies are employed to illustrate that managing type 2 diabetes is akin to fine-tuning a complex instrument, where every adjustment in lifestyle or medication contributes to a harmonious balance within the body. The narrative also emphasizes the critical role of continuous monitoring and regular medical consultations to assess progress and recalibrate individual management plans as needed. The overarching message is one of empowerment. By adopting disciplined, informed, and adaptive strategies, individuals can manage their condition proactively and maintain a high quality of life, even in the face of chronic challenges. As the narrative draws to a close, the final segment offers a synthesis of the key elements discussed, imparting guidance and optimism for living with type 2 diabetes. The narrative encapsulates the journey by reiterating the importance of robust self-care practices, regular health monitoring, and the proactive adoption of sustainable lifestyle changes. It paints a picture of a future where informed decisions and effective management foster resilience and lead to a healthier, more vibrant life. The concluding thoughts underscore that while type 2 diabetes remains a serious condition, the empowerment derived from knowledge and early intervention transforms it into a manageable challenge. The narrative leaves the audience with a clear message. With careful attention to diet, exercise, and medical advice, individuals can navigate their condition while preserving a high quality of life.